The Cardiothoracic Centre, Liverpool NHS Trust.
Information for patients.
Cardiac Rehabilitation. The Cardiothoracic Centre NHS Trust, Thomas Drive, Liverpool, Merseyside, L14 3PE. Telephone 0151 228 1616. This leaflet has been written to provide information about cardiac rehabilitation. We hope it answers some of the questions or concerns you may have. It's not intended to replace talking with medical or nursing staff.
What is cardiac rehabilitation?
Cardiac rehabilitation is a recognised national programme aimed at helping people with heart disease. You'll be invited to join a cardiac rehabilitation programme if you have had a heart attack, if you've had heart surgery or had stents, annuloplasty, or other heart conditions. It's important that you understand your condition and its treatment and how you can return to a healthy, active lifestyle and lower your risk of future heart problems.
What are the benefits of attending a rehabilitation programme?
Cardiac rehabilitation is an essential part of an overall treatment plan for people with heart disease. Many people find that attending a cardiac rehabilitation programme can improve their overall quality of life and may reduce the likelihood of further heart disease. It can also help you to regain your confidence by knowing what you can do to help yourself and reduce your risk of further problems. Attending a group will allow you to meet other people who have been through similar experiences to yourself, which can be reassuring to you and your family.
What is involved with cardiac rehabilitation and where does it take place?
There are 4 phases of cardiac rehabilitation.
Phase 1.
Takes place whilst you're in hospital. This usually involves speaking with a nurse practitioner or attending a talk. The talk highlights what changes you can make to help prevent further heart disease, resume an active lifestyle and possibly return to work if this is appropriate for you. The next phases of cardiac rehabilitation take place after you have left hospital and you'll be contacted directly by your nearest rehabilitation centre.
Phase 2.
Is a phone call or a home visit made by a member of the cardiac rehabilitation team in the community, usually a week or so after you are discharged from hospital. You will have the opportunity to ask questions and discuss any concerns you may have, and you'll be invited to attend a rehabilitation programme.
Phase 3.
Is an organised, supervised programme and it's highly recommended that you attend. You may be encouraged to bring a friend or relative along. It involves participating in a supervised exercise programme as well as information and advice on all aspects of healthy living, relaxation, medication and management of stress. The rehabilitation team consists of many members of the multidisciplinary team, e.g. physiotherapists, pharmacists, nurses and various counsellors. The rehabilitation programme usually takes place at your local hospital, although it can occasionally be in other community settings.
Phase 4.
Involves attending a local leisure centre or other community facility following completion of Phase 3. There are many community-based programmes available, and if you're interested, you'll be given contact details at the end of Phase 3.
How long does the programme last and how often do I need to attend?
Phase 3 usually requires you to attend twice a week for about 6 to 8 weeks, although this varies depending on the individual rehabilitation centre. If you choose to continue cardiac rehabilitation to Phase 4, many centres run programmes lasting approximately 12 weeks. To help you continue with a healthy lifestyle after your rehabilitation programme is finished, you may wish to speak with your GP or practice nurse about prescribed exercise programmes, continuing care and services available, and continue to monitor your progress and offer support.
What can I do to prevent further heart disease?
There are many risk factors for heart disease, some of which you can't change, such as family history of heart disease, your age and whether you're male or female. There are, however, many changes you can make which have been proven to help prevent further heart disease.
Smoking.
If you smoke, now is the time to stop. Stopping smoking is the single most effective step you can take to help yourself. From the moment you stop smoking, the risk of a heart attack is reduced and is halved after 1 year of stopping. If you would like help to stop smoking, contact our smoking cessation advisor on 0151 288 2455.
Healthy eating and weight.
Following a sensible low-fat eating plan and eating the recommended daily intake of 5 portions of fruit and vegetables per day can help you to remain healthy and stay at a sensible weight. Keeping close to the recommended weight for your height can help to control your blood pressure and reduce the amount of work your heart has to do. Eating a low-fat diet will help to control your cholesterol, which is a fatty substance that can build up in your arteries and cause them to narrow.
Exercise and physical activity.
During your rehabilitation programme, you will take part in a supervised exercise programme designed to meet your individual needs, level of ability and heart condition. Exercise can help to reduce blood pressure and cholesterol and help to maintain a healthy weight.
Alcohol intake.
It's recommended that alcohol intake should not exceed 21 units a week for men and 14 for women. 1 pint is 2 units. 1 short pub measure is 1 unit. 1 small glass of wine is 1 unit.
Please note.
You should avoid alcohol whilst taking painkillers as it increases the potency of the drug. You should limit the amount whilst taking warfarin as it increases sensitivity and will disrupt your clotting factor, which may affect the dosage you receive. Your doctor would be happy to discuss this further. If you feel your alcohol intake is too high or you would like help, please contact your GP.
Stress.
During the rehabilitation programme, you'll be taught the importance of relaxation. There are many methods which can be used to aid relaxation, relieve stress and promote a positive, healthy recovery.
Blood pressure.
High blood pressure can increase the risk of heart attacks and strokes. If you have high blood pressure, it's important to have it checked regularly. This will be done regularly during your rehabilitation classes and continue with any medication you may be on to control it. Avoiding salt in your food can help to control blood pressure too.
Diabetes.
It's very important to control your blood sugars if you're a diabetic. Doing more physical activity, controlling your weight and taking your medication regularly will all help. You'll be given a discharge advice sheet containing information about driving, returning to work and resuming normal activities after individual procedures. There are a number of support groups who are able to offer help and advice. Please call the PALS office on 0151 600 1257 for contact details of the following: Zipper Club Broad Green Heart Support Group. For further information, call Cardiac Rehabilitation Practitioner on 0151 228 1616. Or visit www.ctc.nhs.uk or www.nhsdirect.nhs.uk or www.bhf.org.uk or www.dipex.org, or contact the British Heart Foundation information line on 0845 070 80 70.